Oh, good afternoon. Welcome everybody to Facebook Live. Today is Thursday, May 21st. I'm Bobby Webster, the Public Relations Director for the Oneida Nation. And today we have Chairman DeHassy Hill, as well as the Director of EAP, Carol Bauman, and a counselor from EAP, Crystal House. So I have a few announcements that I want to share with you today before we get into the rest of the program. The primary for the general election of the Oneida Nation has been canceled. The election is scheduled for July 25th. The primary is something that is in the authority of the election board to cancel due to a large gathering and substantial risk to citizens of the Oneida Nation. However, the Constitution does require our election to be held in July, so they are doing everything possible to make sure that we can preserve that date. If you have questions about that, I'm going to give you a website to go to. It's the Oneida Nation's website, www.oneida/nsn.gov. Click on the government, then go to boards, committees, and commissions, and then go to the box that says elected. Then you will see highlighted in orange election. You can click on that and you go down to the Oneida Election Nation Laws and Voting. That will bring up the announcement that the primary, just the primary that was scheduled for Saturday, May 23rd, has been canceled. This has been sent out tribal-wide. It's been on our Facebook and on our webpage. And it says the election board may cancel the primary election when a large gathering of people present a substantial risk to the health and safety of the nation's citizens. So again, just the primary has been canceled. And go to the tribe's website to get that information. And as always, we continue to encourage wearing masks. We have our masks here. We also show social distance here so that I can speak without the mask unless we have more people up here. We also wipe down our surfaces and provide a clean environment and make sure that we try to disinfect everything that we can. Let's see. There's also, let's see, I have to take this hat off and put on my Dr. Webster for the medical update. So today in the state of Wisconsin, as of this morning, we had 13,413 positive cases in the state of Wisconsin. Outagamie had 153 cases. Brown County had 2,135 cases. The Oneida Nation Reservation, that's part of Brown County side, had 14 cases, and the Oneida Nation that's on the Outagamie County side had 18 cases. Currently, we have 15 people that are active and still in isolation, and as we know, some of those statistics change hourly, change day by day. Those are our latest statistics. They're continuing to work with Brown County, the De Pere Health and Oneida Health departments to assure that they're all briefed and that they're following a unified command, that they're working to slow the spread of the virus as well as increase testing as much as possible. Those are my updates today. And at this time, I'm going to turn this over to Chairman DeHassy Hill for his message today. Chairman Hill.
All right, thank you, Bobby, for the introduction. On Tuesday, May 19th, the Oneida Nation took action that will safely start the process to reopen the economy on the reservation. Businesses can begin to reopen tomorrow, Friday, May 22nd. Our community continues to take responsible action by following our current safer at home order, which was extended to June 11th. I strongly feel the implementation and following this order, we will keep the cases within our jurisdictions low and our family and friends safe. The balance between the continued protection of our community and the needs of business is a challenge we recognize. Prior to Tuesday's action, businesses were not allowed to operate on the reservation. Businesses wishing to reopen on Friday are required to submit a business plan that ensures that they are taking the appropriate steps to protect public safety. The Oneida Nation Public Health Officer will approve all plans before a business can reopen. Oneida Nation recommends businesses on the reservation to exceed the basic recommendations set forth by the Wisconsin Economic Development Corporation, the WEDC. Our expectations and goals of any reopening plan is to have safer business plans in place equal to or greater than those set forth by the WEDC. Peak test results appear to have been reached on the national and state levels. Although Brown County continues to see higher positive test rates, those positive test rates are stabilizing, and any current increases are likely due to increased testing. The safety of our community has always been and is still one of our most important priorities. We will continue to assess the pandemic and make decisions based on the recommendations from our trusted health professionals. So I'd like to thank you and for continuing to follow the Safer at Home. Obviously, the social distancing, washing your hands, masking when in public are all steps to help preserve the work that our community has done thus far in keeping our numbers low in our community. As Bobby had just shared our numbers, about 32 positive cases within the reservation jurisdiction, and about half of those have been recovered. So we hope and we pray that the message is still heeded to maintain the social distancing, washing your hands, staying home as much as possible. But I do also want to share there are plenty of opportunities for households and families to get out into the reservation and walk the trails, go fishing on our lakes, our streams, the rivers that are available. I went for a walk this morning right here at the Norbert Hill through the woods. There's plenty of trails back here. They weren't too wet, even though we just had a significant amount of rain earlier this week. So that was a nice little walk in the woods, and being able to see all the flowers starting, the spring flowers in bloom right now is another great opportunity to relieve some stress. So again, I'd just like to stress the importance of mental health care during this time of a pandemic and the isolation that we've been living with for the last couple of months here. So I would just like to thank you for listening and this opportunity to address the community.
Thank you, Chairman Hill. And as always, we ask you to please remember to keep your questions and comments relevant to the issues that we're discussing today. I know there's a tendency for us to get a little off track, myself included, but let's try to make sure that our comments and our questions are relevant. And so next we'd like to hear from Crystal House, who's a counselor with EAP.
Thank you, Bobby. Sagalik. My name is Crystal House. I am one of the Oneida Nation Employee Assistance Program counselors. Today we are here to share some of what we do at EAP and how COVID-19 has affected how we've been operating. One way that COVID-19 has impacted our department is that we currently are doing all appointments by phone. In March 2020, President Trump took action to adjust policies that regulated telehealth and the use of other non-public sharing platforms such as cell phones and apps like FaceTime and Zoom to conduct mental health appointments. This allowed counselors and therapists the opportunity to stay connected during the COVID pandemic without the fear of breaking HIPAA or confidentiality policies. We have followed suit by adjusting our availabilities and rerouted our office phones in order to conduct appointments while protecting confidentiality. With the number of employees being furloughed and laid off currently, we have been trying to communicate our role by including our phone numbers with all outgoing information as a reminder of our services, and that we would continue to provide help if an employee or family member should have need. If a current employee is not called back to their position and is separated from the organization, they still have access to EAP services. Oneida Nation EAP services will continue for up to 52 weeks from the effective date of layoff/furlough, even if employment is separated after 26 weeks. This is to ensure that the employee has continued access to mental health care through EAP. Other impacts we have felt due to COVID-19 are we had to cancel all reasonable alternative standard, also known as RAS activities. These activities have included group presentations on ways to help lower stress by introducing positive coping mechanisms such as meditating, journaling, adult coloring, and breathing exercises. Although we are no longer presenting these type of group activities at EAP for the RAS program, we are available to offer some resources and help educate employees individually on different ways of managing their stress. In addition to canceling our RAS presentations, we have also had to cancel our upcoming book clubs. These clubs have been utilized to help strengthen departments and help employees learn more about themselves and where they fit within the organization, as well as how to best use their talents in the workplace. Our book clubs will be offered again in the future with all health and safety precautions kept in mind. Our upcoming trainings for new supervisors have also been temporarily halted due to COVID-19. While the trainings are in the process of being rescheduled, we are still available for supervisory consultations. If you are a supervisor and are struggling with how to address employee conflict, how to go about referring employees to utilize EAP, or how to help an employee with issues particular to COVID-19, please reach out to Carol or myself and we can discuss a plan of action. In the past, EAP has participated in mental health awareness days at the Oneida Nation Elementary School, as well as been called in to help with crisis debriefing and grief processing in other departments. We are currently unable to travel to other areas or departments during the Oneida Nation Safer at Home order, but as a reminder for when the future allows it, we are open to meeting at other areas within the organization. Our plans going forward are to continue offering telehealth services until we can safely open our offices for face-to-face appointments. We are in the process of exploring the use of bigger meeting rooms for client appointments, as well as staggering appointments so that our facility is properly cleaned before and after anyone is seen. We are also practicing safe distancing, wearing masks, and adhering to strict hand washing protocols. We at the Employee Assistance Program acknowledge the benefit of face-to-face contact and would like to meet with individuals as soon as it is safe to do so. Currently, utilizing telehealth and phone appointments is the best way to keep all parties protected and safe. Now I'd like to turn it over to Carol Ballman for some additional information.
Thank you, Crystal. Sigoli, ola unkwa ni yungets, waganyanta ni wagitaloda, onioteaga ni wagutindroda. I'm Carol Ballman, the manager of the Oneida Nation Employee Assistance Program. Crystal has just shared information how our basic offerings have been affected by COVID-19 and how we are maintaining contact with all employees and their families. I would like first to share some concerns that I hear and have heard from the employees. Stress has been added to everyone's life since the awareness and the arrival of COVID-19. An article from the CDC, which will be posted on the COVID website after this, will be available to read in full. Right now, I'm going to just highlight a couple of the areas from that website. They're going to be talking about recognizing the symptoms of stress that you may be experiencing. Just a couple that are mentioned is feeling irritation, anger, or in denial, feeling tired, overwhelmed, or burnt out. They also talk about knowing the common work-related factors that can add stress during a pandemic. You have concern about the risk of being exposed to the virus at work, taking care of personal and family needs while working, and the uncertainty about the future of your workplace and or employment. You can follow these tips to build resilience and manage job stress. Communication is very important. Communication with your coworkers, supervisors, and employees about job stress while maintaining social distancing, at least 6 feet. Identify things that cause stress and work together to identify solutions. You can talk openly with your employers and employees about how the pandemic is affecting work. Expectations should be communicated clearly by everyone. Ask about how to access mental health resources in your workplace. Identify those things which you do not have control over and do the best you can with the resources available to you. These are just a taste of the full article. And like I said, Bobby will be adding that to our COVID website, or yeah, online. Thank you. Secondly, the nation is working with about half of the workforce. Taking time to communicate with staff is very important. The Live on Facebook time twice a week has been a good communication tool. Additionally, talking with staff, again at a safe distance, talking with staff right now helps to alleviate stress. 10 or 15 minutes a day can let your team know we're in this together. We finally have good, warm weather. Taking a break outside and getting a dose of sunshine during the workday helps to lessen the impact of stress throughout the day. So take advantage of it. Now is the time to realize that we are working for a nation, the Oneida Nation. What each one of us does affects families and communities here in the Green Bay Appleton area, the Milwaukee area, and beyond. This grounds us to why we do what we do every day. We are helping the Oneida Nation through this pandemic with every act that we take. Sitting in meetings deciding how best to spend the stimulus money, answering questions from employees about their work status, processing paychecks, delivering medicine and food to tribal members at risk, delivering food to school children. Take a look at all our efforts to take care of our community. I like that Junhekwa is handing out seeds for our gardens. Celebrate that even while we worry about the unknown, we carry on for each other. We're getting uncomfortable with all the changes we're having to deal with. Get your head around that life has changed. We need to look forward, and a vaccine won't be available for maybe a year or longer. Change is something that no one likes or enjoys. If you find yourself getting stressed out about the unknown, call us at EAP. We can listen and help you decide what you need to do in the moment, and we offer confidentiality. People have been called back to work, and with that comes new anxieties and new stress. Dealing with all the change going on can be stressful, and the change is constant. Talking recently to an employee who was called back to work, the person wasn't ready. However, if they were to wait, it can create other stress or hardship. They could possibly be exposed to COVID-19. We simply don't know. There's new rules, new processes. Will it be forever that way? We don't know. All we have is what faces us that moment, and there are others in our lives who love and care for us. We're going from being very predictable to a time of total unpredictability. You don't need to sit or suffer through this alone. We're here, Crystal and I, If you are looking for someone who is objective, you can call us. Our numbers, if you want to talk to me, the number is 920-490-3716. And if you would like to talk with Crystal, her number is again 920-490-3706. Yawanko for listening.
You have such a calming voice. Thank you, Carol. I'm just like, I could just sit here. That really calms me down. That tone is very important when we have our EAP people here, that they deal with their people and they calm them, and that they have that very soothing voice quality. So one of the questions, Carol, that came in was, how does EAP communicate the number of clients that they serve? And do you have a number on your current caseload?
Let's see. We do. We have a software program that there is no contact with the tribe, with the nation, with our businesses at all. It's totally accessed and specifically accessed by Crystal and I. We keep account there. I think it's a 3-month report that we send in to Nick. We were a little quieter before we weren't seeing as many people before the COVID-19, and it's gone up considerably. So, but we have space for you to call.
Well, good, because that's a question, is that during this pandemic time, sometimes individuals recognize other people who they are in contact with who may need your services, but they may not call. So, for example, I'll say my son needs your services, because I don't have a son, so I'll use that as an example. My son needs your services, he won't get your services, so what can I do to connect him in the services?
Well, I think one of the big advantages, it's weird to talk about a big advantage for COVID-19 right now, but we can talk to you over the phone. We will ask for your name and address, to keep our records on our software. But again, that software doesn't have, we're the only ones that know it. Nothing is known or shared with the tribe in any way. It does not go to HRD. It is not shared with the health center or with behavioral health. So it's completely confidential. We follow HIPAA rules. So I think that's the best that we can offer. I think that's one of the issues that has been following. I've been here for the tribe, or here with the tribe for 25 years, and that's always been a concern, is who is EAP talking to, or who is behavioral health talking to, because this news gets out. It doesn't come from us. We're bound under law, the state of, we're licensed under the state of Wisconsin, and we're bound. If that gets out that we did something, we could lose our license. So I do what I need to do to protect my license.
Absolutely. Thank you. A couple of other general pieces of information. Again, we are getting a lot of questions that aren't really relevant to our presenters today, but they always come in about HRD questions. So I just want to say that they do have their hotline, 490-3699, or you can email them at HRD_general@oneidanation.org. So that's a resource. I know there's a lot of questions about when something is opening, how buildings are opening, who will be getting called back, dates and things like that. So you need to contact HRD for the employment related questions. Also, questions about the reopening of businesses on the reservation. Again, that is what Chairman Hill responded to and provided information about the reopening of essential businesses. And again, the key thing here is a plan. These businesses have a plan. And all of the businesses that we're looking on in the reservation under our jurisdiction, we strongly urge and require them to have a safety plan put in place to keep themselves as well as all of you as safe as possible. That means they have to look at whether they're going to require masks, building capacity, gloves, sanitation, those kinds of things. So we're looking for things to open up and recover as well as possible and as safe as possible. In closing, I just want to remind everybody that tomorrow, May 22nd, is Oneida Nation Code Talkers Day. This is the day we honor and celebrate the memory and achievements of our Oneida Code Talkers. In November in 2013, the memories of 4 men were honored with the presentation of 4 congressional medals. Those 4 Oneida warriors, along with warriors from 33 other tribes, included Rupert S. Adams, Hudson Dockstader, Rimpton Dockstader, and Lloyd Anogi Schuyler. The Congressional Medal represents the highest expression of appreciation for distinguished achievements and contributions. Until 2013, these brave, dedicated men received no recognition for their life-saving actions. This was considered top secret information. Because this was such top secret defense, these soldiers were told they could never speak of this code. And as strong, patriotic warriors of honor, most of them never did. Even after the military made it public, most of these men carried that secret to their graves. So we never really got to say thank you to Rupert, Rimpton, Hudson, and Lloyd. So y'all go. So today, in memory of these people, we just want to invite everybody to extend some prayers and appreciation for the memory of those warriors. It's with a good mind, a good strong fire, that we're grateful for the heroes who continue our legacy of a nation of strong families built upon Jitni Yung Wali Hodo and a strong economy. We continue to strive to protect our people, our environment, and the Oneida Nation. We continue to encourage people to remain safe at home. We know things are opening up. If you venture out, as the chairman said, make sure you wear a mask, wash your hands, use the disinfectant, try to limit your access. People are moving about. We've got beautiful weather, as Carol mentioned, and we really need to be mindful that our order is extended till June 11th. That doesn't mean we're locked inside. It means we're recovering. We're recovering slowly and safely to protect our people, to protect ourselves, our homes, and our families. The Wisconsin Indian Veterans Association, WIVA, is planning on doing a very small Memorial Day ceremony at the Veterans Memorial Wall at 11 o'clock on Memorial Day, which is Monday. When I say small, they're telling me it's a 21-gun salute and taps. Our veteran community came to the consensus that they should pass on this year's putting flags on the veterans' graves due to the COVID recommendation that comes from their commanders and from other veterans. Monday at 11 o'clock, Facebook Live will be at the Oneida Nation Veterans Memorial Wall to share that. So we don't need to have a crowd of people out there. Facebook Live will be brought from the Veterans Wall. Next Friday, we'll be back with HRD on Facebook Live, and they can answer the questions that you have relative to employment and things that are happening. So with that, we ask you to stay safe. Remember to take care of yourselves and your families, to say your prayers, And pray for those who are not in isolation at this time, but who are recovering, and for those that may be in isolation soon. So say your prayers and be well. Yawan po.